Hi, this is Spitfire with Road Guardians and Accident Scene Management, and I'm going to be talking to you today about how to properly help someone who's not breathing at the scene of a motorcycle crash. I've got my little friend Annie Rebel here who's going to be helping me with this today. And you can see that she's been hanging around for so long, she's even got a tattoo. So she's not like just any Annie doll. She's met a lot of bikers in her lifetime. So the thing that you're most often taught about how to handle an airway crisis with somebody who's not breathing is because many people are taught CPRs, they're taught how to do a head tilt chin lift, and it looks like this. Well, of course, in a motorcycle crash, we're always going to be concerned about neck injuries for a person, so that is way too much movement of the person's neck. They also teach you to do chest compressions. And with chest compressions, then you can help this person just bleed out faster. Now, the most recent thing that they've been teaching with CPR, which is great for heart attack, by the way, is that if the person goes down and isn't breathing, you're supposed to just tip the head back and then press on the chest, and that there's some passive movement of air going in and out when you press down and back up again. Now, again, I want to say that that is great if somebody's having a problem with their heart that just stopped, but in a crash, the most common reason a person is not breathing is because they were knocked out so significantly and they're so unconscious that their tongue falls to the back of their throat and blocks their airway. The heart is still working, blood is still pumping around. So when it comes to a traumatic event, you want to do something called jaw thrust to lift the person's tongue off the back of the throat. And what that looks like is it looks like this. And you see that I'm tracing the person's jaw and I'm getting right in back of this angle of the jaw. And then I'm lifting that tongue to lift the tongue off the back of the throat. It keeps this neck nice and straight. If the person still doesn't breathe on their own, then I need to help them. In order for me to be willing to help them, I would want to use the proper supply. Most people, and that's us as well, accident scene management, recommend the triangle style barrier. When you take this out of the container that it comes in, it's going to be collapsed, and it always has to be popped into this upright position to be prepared for use. This pointed part goes to the bridge of the nose and is placed down, so it looks like this when you put it on the person. You're going to put your hands on either side so that you can get a good seal, and again you're going to trace the jaw so that you get in back of that angle of the jaw. You pull up and give a breath. You always want to give 2 breaths initially and then 1 breath every 6 to 8 seconds. It would look like this. 1002, 1003, 1004, 1005, 1006, 1007, 1001, 1002, 1003, 1004, 1005, 1006. 1001, 1002, 1003, 1004, 1005. 1002, 1003, 1000. Well, you get the idea. It doesn't matter how you do this, as long as you give 1 breath every 6 to 8 seconds, and as long as you count to slow yourself down. Your adrenaline's going to be kicking in, and you're going to go much faster than you would expect. So try counting out loud to make sure you do this properly. Another thing you noticed was how much air I was giving. More air is not necessarily better. It goes into the stomach, so you only need enough to inflate the lungs and you see a little movement of the chest, and that's good enough. A 1-second breath is all that's required. So you'll give breathing until the person starts breathing on their own, until somebody else gets there who takes over for you, or until you simply just cannot do this anymore, and that really does take a long time to get to that point. Now, the only exception to this rule, as far as that you address somebody by going to breathing first in a trauma situation, is when the person is bleeding massively. You would take care of massive bleeding first because breathing can wait for a few minutes. You've got about 5 minutes to get air into this person before they start suffering brain damage. So yourself, Personally, take a deep breath, make the right decisions, and get trained. I'd like to thank you for joining us today. We gave you a little information, but that certainly does not take the place of a full bystander assistance class. You can get more information at roadguardians.org.